OCD is a fairly common psychiatric illness because 2 to 3 in every 100 individuals develop it in some point in their lives. In most cases, it begins before individuals have crossed even 25 years of age, sometimes as early as in their childhood. As the name suggests, the main features of this illness are obsessions and compulsions. So, what are obsessions? Obsessions are very specific thoughts, images, or urges that are unwanted but occur repetitively in a person's mind. In most cases, they are recognized by the person as being senseless, irrational, and however, they are unable to suppress or disregard them in any way. Obsessions can be extremely distressing and cause significant anxiety and can interfere with a person's daily functioning. So, some examples of obsessions are fear of getting their hands or their body dirty or contaminated or even impure by things around them in their environment. Having blasphemous or immoral thoughts in their mind, repeated thoughts or images of sexual nature. In response to the anxiety caused by these obsessions, a person resorts to performing compulsions. Now, compulsions are repetitive acts that are carried out specifically with the intent of reducing the anxiety that is caused by the obsessions, even though they are again meaningless, excessive, and considered unnecessary. For example, repeated hand washing or bathing or even washing clothes in the house as a response to feeling dirty. Repeatedly counting numbers or objects in the surroundings, such as windows, tiles, trees, in a certain manner. Repeatedly checking locks, doorknobs, knobs of a gas stove, light switches. Because of this, a person gets stuck in a vicious cycle of obsessions and compulsions. Because of that, it can end up severely affecting their lives, their day-to-day activities, their work, their relationships with their friends and family. Secondary to OCD, a lot of individuals also develop other psychiatric illnesses such as depression and anxiety disorders. While the exact cause of OCD is not known, multiple factors such as alterations in brain neurotransmitters such as serotonin, abnormalities in the brain connections between different brain areas, abnormalities in genetic makeup of individuals, stress due to any cause such as financial, relationships, social circumstances have been seen to be contributory. As with other illnesses, OCD also requires a combination of medications and psychological interventions such as behavioral therapy. Medications help not only by improving the obsessions and compulsions, but also other disorders such as depression and anxiety that might happen secondary to it. Therapy, on the other hand, involves something called as exposure and response prevention or ERP. The basic idea of ERP is to encourage a patient to gradually expose themselves to the anxiety-provoking obsessions and getting habituated to the discomfort caused by it without actually resorting to doing the compulsions. For example, someone who has OCD related to contamination and dirt might be required to get their hands dirty and then not resorting to washing them when the anxiety hits. With repeated such exercises, the patient can eventually get used to the anxiety, secondary to which the obsessions and compulsions have been found to actually gradually reduce and even disappear over time. With a combination approach, along with support from family members and friends, OCD can be managed very effectively.